Hey there, good morning, and welcome to another edition of Health on Traxx. It is the 11th of August 2025, and it's 11:15, as you know. It's 11:16 right now, and today we're going to be talking about the importance of influenza prevention. Now, influenza, we've heard a lot about it, but today we're going to be digging deep into it. And joining us today is Dr. Rakhee Yadav, who is a consultant pediatrician with KPJ Damansara. And welcome to the studio, Doctor. How are you today?
Thank you so much, KG. I'm very good.
All right. So, Doctor, today we're going to be talking about influenza. This is your field, and especially since you're a consultant pediatrician, so the children are your expertise. So, let's start off with this question then. We hear of influenza cases a lot in the news lately. Not only lately, I think for the past 3 to 4 years, right? Ever since COVID came about. Now, what are the most common symptoms of influenza? How can they be differentiated from other respiratory infections like, as you know, COVID-19 and the common cold?
I like how you jumped right in there. So influenza, or commonly known as the flu, which is actually not the same as the common cold, It causes millions of infections annually and tens of thousands of hospitalizations and deaths. So it's something that's still very relevant, even though it's been in the scene for many years. The most common symptom of influenza is a high fever, sudden onset high fever, body aches, chills, fatigue, sore throat, and cough. I know this sounds similar to almost any other respiratory viruses or respiratory illnesses, but what makes the influenza a bit different is the sudden onset. It's 1 minute you're fine, one day you're fine, and the next thing you know, you've been like hit by a truck. That's how symptoms can have a sudden onset and a high intensity compared to the common cold, which is often mistakenly called the flu. So it's a misnomer. So influenza is the flu, not the common cold. The common cold starts a bit more gradually and very much more milder symptoms. And we know that COVID-19 usually causes loss of taste, loss of smell. This is not seen in influenza patients. But to discriminate or to differentiate between any of these illnesses, whether it's influenza, COVID, RSV, or any other viruses out there, it is important to see a doctor to get a nasal or an oral swab done, and in some cases a blood test, right? Because it's very difficult to differentiate based on just symptoms per se. And if you're not sure, seek your doctor's opinion.
Yeah, I mean, like, even the common cold, like, evolves every, few weeks. Once it evolves and evolves and evolves. So unless you do, like, a specialized test, like the nasal swab, you're not going to find out, are you?
Yeah.
Suddenly it could be COVID, suddenly it could be influenza, suddenly if you're lucky, then it's just the common cold.
Common cold.
Right, but when you say onset, right, like a sudden onset, like, what is the time duration that is?
Within 24 hours.
Within 24 hours.
In the morning, you might not have a fever. By evening, you have a sudden high fever. And these fevers can go up to 40, 41 degrees. So it's even more alarming if you have a child and your child is suddenly well in the morning and evening comes back from daycare with a high fever and totally lethargic.
And then as parents, they do tend to panic and then they'll start blaming everyone, including the daycare. I'm like, the daycare, we don't know.
Yeah,
it just happened.
Blame game begins from there.
But the thing to do is, at that point, no blame game, go straight to the doctors.
Yes, absolutely.
All right. And why is it considered dangerous, influenza that is? And what are the potential complications that could arise from influenza infections, particularly among high-risk groups? And could you explain high-risk groups to us?
Can, sure. So while most healthy people like you and me, touch wood, healthy, recover from the flu in a few days to a week maximum, maybe 5 to 7 days, but it can lead to serious complications, especially in high-risk groups. So high-risk groups can be divided into 5. The elderly, those who are 65 and above, young children, especially those below 5 years old, pregnant women, those with weakened immune system, and this could also be in a young adult who has diabetes, hypertension, or heart problems. And finally, a healthcare worker, which includes myself. All right. Complications include pneumonia, bronchitis, encephalitis, and it also can cause worsening of a chronic illness that you already have. So if you're a diabetic patient and you get influenza, it worsens your diabetes or your sugar levels. If you're a hypertensive patient, it worsens your hypertension and your blood pressure levels. Or heart problems. So it's been known to worsen already known chronic illnesses that a patient might have. And the worst case scenario is influenza can be fatal. Can lead to death in certain groups of patients, especially these high-risk ones.
So people who belong within this particular groups, they should really take care if they have and that's why you said, go see the doctor as soon as you can. Right, and talking about earlier you said the elderly, young children, as well as pregnant women, right? Like, is it different, the presentation of the symptoms and all of that within them?
Yes, it's different to everyone it could be different, right? So to a pregnant woman, it could lead to early, early delivery, to premature delivery. It could lead to early contractions, and that may be also due to other reasons. So you have to seek a doctor's opinion. For an elderly person, it can mimic some underlying illnesses that they may have. So it's very important, if you have a fever and you fall into any of these high risk categories, seek a doctor's opinion and get it clarified, because the earlier the treatment, the better it is.
And of course, one of the best prevention methods, one of the best ways that we can work against influenza is, of course, vaccination.
Absolutely.
Why is it important to get vaccinated? And why is that? Because this is a question that even I have. I've interviewed many doctors on the show, but this is a question that even I have. Why is there a need to vaccinate annually? Why can't it just be like one shot and we're done for life?
Well, research is ongoing to look for the perfect vaccine. We all know that. But vaccination is our best protection against influenza at the moment, right? Influenza virus mutates. It mutates so often. In fact, every year you might have a different mutation.
Yeah.
And that's why the vaccine that you may have taken last year won't exactly work to protect you against the strains this year. Since COVID, we're now used to the words different strains, different variants.
Yeah.
So similar with influenza, you have different variants that come about, and the virus mutates more often than COVID, in fact. All right. So by updating your vaccine on a yearly basis, it ensures that your body is prepared to fight against the most common circulating strains, not the old strains, 2 years ago strains and things like that.
Yeah, those are most likely dead.
I wouldn't say dead, have mutated to a different strain.
Mutation.
Right?
Yes.
So mutations are, so not dead per se, but they mutate and they move on to another strain. All right? And it's not just about protecting yourself. We have to remember that there are many around us that can't get the vaccine for medical reasons, and those are the ones that you want to protect, which is what we call herd immunity, right? So one thing to note, like people might think, oh, if I'm getting the vaccine every year, is it the same vaccine? No, it's not. So WHO, or World Health Organization, actually every year, in fact twice a year, analyzes flu patterns worldwide, right? So when they analyze it, they look at which strains are actually spreading in different continents, different part of the world, northern hemisphere, southern hemisphere, and they predict which ones are most likely to cause an epidemic, or which ones are most likely to be dominant in the next upcoming season. Based on this data, they update the vaccine on a yearly basis, and that's when we get. So it's sort of like preparing your body for an exam. You're studying to know which is what is coming out for exam. This is coming out for exam, and that's how the influenza vaccine is developed by WHO and many other organizations. But unlike temperate countries, right? So they have northern hemisphere, southern hemisphere. We have winter, autumn, spring. Malaysia is a tropical country, so it is not seasonal in Malaysia. It happens year round, throughout the year. And usually in Malaysia, it's around the school holidays. That's when, right after the school holidays. But throughout the year, compared to temperate countries where it happens during winter, right? It is sufficient to get the vaccine once a year, and ideally at a time that you can remember. For instance, your birthday or school holidays or something like that.
Yep. I still remember when I was younger, I did have a sudden onset fever. Now that I'm looking back at it, it did happen about the school holiday. I was very excited in the morning, and I had fun running all over the couch. My mom beat me. I don't think
Asian parenting.
Yeah, Asian parenting, because she just got the couch and I was running around. And literally 2 hours later, I was down. I was gone. I was like completely flat. My mom was like, "Did I beat you into this?" And I was like, "No, you didn't beat me that hard." I actually had to support her for a bit. She felt really bad.
She felt bad.
Yeah, but then now looking back at it,
Yes.
I could see that could have been
An influenza.
An influenza attack.
Absolutely.
Yeah, so that is kind of scary, right? That sudden onset part of it. And I would just like to segue a slight bit. Vaccination has a bad rap with some groups, and they call themselves anti-vax. What's your opinion when it comes to something as, like influenza? It's such a scary disease. It's such a scary thing. How do the anti-vax work into this? Has there been any issues that they have caused that? Because you also mentioned herd immunity. Has there been any effect towards that herd immunity with the anti-vax groups?
Well, for anti-vax in influenza, I won't say it's a major concern. I think the major concern for us is awareness of influenza vaccination,
The
the need
availability.
for an annual vaccination. Like, if you remember early this year, there were 2 celebrities from other overseas countries that passed away of influenza. Young, good-looking, totally a full life ahead of them, and they passed away of influenza. So after that, there was a huge surge in influenza vaccinations. In fact, we ran out of stock of influenza vaccines in many clinics and hospitals. So because of these 2 celebrities, there was awareness of what influenza is, how deadly it can be, and how it can be prevented with vaccines. So that's when the surge of vaccinations come about. So I won't say, our coverage for vaccinations, for influenza vaccinations in Malaysia is below 10%. Is really small. Like, I vaccinate myself and my family, but that's just a small proportion out of the 30 over million Malaysians who don't realize about what influenza is and something that can be protected. I think everyone is vaccine fatigued after COVID since
True.
the new vaccine came about, but I won't say anti-vaxxers are our major concern with influenza. It is more of lack of awareness and the fact that people don't realize something is there until something bad happens.
Actually, what you just said is very, very true, because I have a relative who's in the healthcare industry, and she made both of us, me and the wife, to take the influenza vaccine last year. Without her telling us to do it, I would not have done it.
Exactly. So awareness. In fact, there was a study that actually showed that 80% of people get to know about vaccinations, not just influenza, from their healthcare professionals. So it can be a GP, it can be their pediatricians, from a doctor. So endorsement from a doctor, it sort of safeguards that, okay, reassuring me that this vaccine is something that we take day in, day out, is something that has been there in the market for more than 80 years. So it's something safe to take.
It is just a part of life right now. It is just part of modern life.
Absolutely.
And of course, now for our listeners out there, as well as for me, how does the influenza vaccine work? Is it safe even for children, elderly, and we'll add on another group, pregnant women?
Can. So influenza vaccine actually triggers your immune response to produce antibodies against the influenza virus, right? So remember, this vaccine is going to produce against that particular strain that it protects. And so when your body is exposed to it, it realizes, hey, I know this, I'm going to be able to fight against that. All right. So there's evidence that the newer quadrivalent, so there's now the quadrivalent, meaning it covers 2 of the A's and 2 of the B's. So these newer quadrivalent vaccines actually stimulate very good protection, even up to 90%. Also for those who are 60 to 80 years old, at least for 12 months. So we always say get your vaccine annually.
Yeah.
So we know that it gives you 90% protection up to 12 months, even for the elderly, which is, as I mentioned, are included in the high-risk population. A recent study in 2023 also showed that getting the annual influenza can help lower the risk of heart-related illnesses and prevent death for those patients, right? And finally, overall, the influenza vaccine, like I said, has been in the market for more than 80 years, and millions of people have received the influenza vaccine, so safety is not a major concern. At one point, some were worried about allergies and things like that, but of course, if you've had allergies to anything, you would avoid, right? So in those patients, I would say seek your doctor's opinions before you get anything further.
And can pregnant women get vaccinated?
Absolutely. You're one of the high risk. You will definitely be recommended to get the vaccination. I'm quite happy your wife got the last year's vaccine. Do make sure she updates this year's.
Okay, sure thing. All right, so we're going to be taking a short break. And once we come back, there's more questions that we're going to be asking Dr. Rakhee Yadav. And some of the questions include recommended age groups and all of that. So we will talk about that once we come back. Well, of course, if you have any questions on TikTok, you are more than welcome to ask. And if it's good, we'll definitely ask the good doctor. All right. So we'll be right back. Don't go anywhere. We're currently talking about the importance of influenza prevention. This is Health on Traxx, and we will be right back. Don't go anywhere. TRAXXfm, and we're talking about the importance of influenza prevention, health on Traxx, and we've got Dr. Rakhee Yadav, a consultant pediatrician with the KPJ Damansara Specialist Hospital, joining us after a 14-year break.
Thank you for having me back.
14 years, wow, welcome back. Just found out about that. Right, so let's talk about what are the recommended age groups for receiving the influenza vaccine. Are there any exceptions?
Okay, so being a pediatrician, the first group that I would want vaccinated would be the children.
Yeah.
And unfortunately, only babies above 6 months old can get the vaccine. All right, so the first dose can be given 6 months onwards. The first time a child below 9 years old gets the vaccine, it's 2 doses, 1 month apart. Subsequently, it's an annual dose. All right, so now we've clarified children. The rest of them, you can get it anytime on an annual basis, but it's especially important for the high-risk groups. Remember the 5 that I mentioned, the elderly population, more than 65, pregnant women, young kids below 5 years old, those with chronic illnesses, as well as healthcare workers. So when I say healthcare workers, doesn't mean just doctors. It could be nurses, technicians, lab workers, anybody that is in a healthcare facility.
If they spend their time in a hospital,
yes,
might as well.
Yes, exactly. And for pregnant women, it is to note that you can get it at any trimester, first, second, third trimester, but best to discuss this with your personal obstetrician.
So the best part would be to get a consult first.
Yeah, consult first and then ask your doctor, whichever that you're closest to, regarding the influenza vaccination, and they will advise you when's the best time.
And how about the exceptions? Are there people who are actually discouraged from taking this vaccine?
Well, the only thing that I can think of is those who are allergic to an influenza vaccine, like they've had it before and they're allergic. Usually we recommend caution, or you need to discuss whether that allergic reaction was due to the vaccine or due to some seafood you had after that for dinner. So whether you really got to clarify what exactly it is, but nothing out of the contrary.
All right. So in terms of, I had a question on my brain and it just completely slipped. You know what? If I do find it, we will get back to that.
Sure thing.
All right. What are some common myths or Oh, yes, I found the question. Are there many different versions of the vaccine right now in the market? Like, is it only by one pharmaceutical company, or is there many giving it out? And are there different types? Like, I did read about one that is through the nose and
So there are 2 answers to that. One is on a Malaysian perspective. Yes, there are a few companies that all produce the quadrivalent, the 4-valent vaccine.
The latest version.
All right, it's not converted to the trivalent yet. There are a few others in the market at the moment. So in Malaysia, a few companies, all are quadrivalent injectable vaccines. Overseas, certain countries have the nasal, but Malaysia does not have it. So there's no point even talking about the nasal vaccine for our country, because we don't have it and we can't provide it.
Yes. So it's injectionless.
It's injection, yes.
If you're scared of needles, close your eyes.
Come to a pediatrician, we got small, tiny needles.
Oh, so that's where you need to go.
Yes, come
I
see
did
me.
not know. Chen knows that I'm scared of needles. Right. So I'm... Oh my, I mean, I do donate blood, but needles scare me. And the other day I was in the hospital for an emergency thing, and they had a flexible needle which they put into my arm, and I was like, oh my God, that's so scary.
Yeah.
Right.
So look away, cough. There are many ways that we can do to reduce the pain or the trauma from injectables, because you're an adult male. I have kids who are scared. But I have to say this live. Most of the fathers who come and see me with their families are scared of vaccines, and it's not the mothers ever. I mean, the mothers have given birth to life. The mothers have already gone through so much. Yeah. One small injection for them is take it.
Chen, I could hear you laughing, Chen. That is so wrong. Yeah, actually, I'm not scared of needles. That was more of a joke thing. Chen, calm down. Right. So yes, but yeah, you being scared of needles shouldn't actually affect this, because this vaccine is much more important, prioritized, right?
Yes. Yeah.
This is something that can save your life.
Imagine one small needle versus an admission with multiple injections, multiple blood takings. So the trauma of a full admission versus one small needle. Risk versus benefit.
That is the word. Risk versus benefit. Return on investment.
Yes.
And welcome to Finance on Traxx. Right. We already spoke about the common myths. We have yet to speak about the common myths or misconceptions. What are some common myths or misconceptions about the influenza vaccine? how can they be addressed?
I've seen and I've come across so many myths, but if I go through all of them, I think I'll be sitting here till the night show, right? So I'm just going to pick out 2 common myths that I commonly encounter in my clinical practice. So one of the biggest ones is the flu shot gave me the flu.
Huh.
Right? So that's something that a lot of my patients are like, oh, I got it last year and immediately I was sick. Right? So the truth is the flu vaccine does not contain any live virus. So it cannot give you the flu. However, some people do feel a little achy, a little bit of a fever right after vaccine. And that's actually quite common. That just means your immune system is working.
Yep.
All right? Unfortunate cases have happened where you were exposed to a relative with influenza and you rushed and got the vaccine 2 days later. But unfortunately, your body was already exposed to the vaccine, to the virus, and that's where you get the influenza, not from the vaccine, it's from a relative or someone that you were exposed to prior, right? So the myth first one is the flu shot gave me the flu, that we can debunk straight off. Another myth is I never get the flu, so I don't need the vaccine lah. Right? So everybody thinks I'm never going to get it. I'm Iron Man, I'm not going to get anything, right? But like I mentioned earlier, the flu viruses change, they mutate. Even healthy people can get sick unknowingly, right? So if you're very healthy, you may be a carrier. You may have had a very mild asymptomatic, feel a bit achy for 1-2 days, and that's it. And that could be your influenza, right? Or you were vaccinated and your symptoms are much milder and you don't realize you even had influenza, but you have others around you who are immunocompromised or young children or your elderly parents or grandparents who live. We're Asians, we have joint family and they get exposed because you didn't want to get the vaccine, So it's very important to know that you can get the flu whether or not you're healthy or whether you're sick. The virus does not discriminate.
Understood. And what should someone do if they experience symptoms after being vaccinated?
Well, nothing in life is 100%. So it is possible to still catch the flu even if you've been vaccinated, right? But like I mentioned earlier, for those who got the vaccine, up to 90% protection. And if you do have the vaccine, it does reduce your chances of complications and it makes your symptoms much milder. I'm sure anybody out there who's had influenza before, I've had many actually come up to me and said, Doctor, it was worse than COVID. COVID, I had a fever for 1 day, I coughed twice, and that was it. And influenza, I was down for a week, right? So you can even ask your listeners, there are many out there who have encountered influenza and they have severe symptoms. If you've had the vaccine, this would be much milder and like boleh tahan lah. You can really handle it and you can go to work within that quarantine of after 5 to 7 days, right? But if you do get sick, stay home. Don't go on jalan-jalan, don't go around, don't go and see places, don't go shopping, and don't go and visit relatives or anybody with a newborn child. Stay hydrated, stay home, rest and monitor your symptoms, right? If you're in those high-risk groups or if your symptom worsens, seek a doctor's attention immediately because we don't know what complications could arise. And antiviral medications for influenza is best given in the first 48 hours of treatment. So if you're not sure, within 48 hours, seek an opinion. Get even your nearest doctor. Most GP clinics will even have the flu swab, which your results will be out in 10 to 15 minutes, right? So get it sorted, get it done, and treat early.
Yeah. Just because it's not an enforceable quarantine, just, don't abuse it. Yeah.
We don't want to lock down again.
Yeah, we don't. We don't. Right. And where can we find more information about influenza as well as vaccination? What are some available sources out there?
All right. So there are many educational efforts that have been put out there. There are so many websites. You can go to WHO, CDC. But in Malaysia, we have the Flu Prevention is an Act of Love campaign, which aims to spread the awareness and information about influenza and the importance of influenza vaccination to save lives. Not just one person's lives, it's generational lives that you want to save.
Yes.
The babies, the children, the young adults, the elderly, the pregnant women, everyone encompassing. So it's a generational life-saving vaccine. So do ask your doctors about the annual influenza vaccine.
All right, ask your doctors. And it's not expensive, is
No,
it's not.
It's one of the cheapest vaccines out there.
Yes.
Yes.
Please go get yourself vaccinated just in case. If you have children running around, if you have elderly people. And as I said, it's a joint family in Asian countries, man. A lot of us stay together with our parents and, all of them. So make sure that you keep yourself healthy so that you can keep them healthy as well. Now, before we end, Dr. Rakhee, anything else that you would like to add on for our listeners?
I'd like to just reassure everyone that influenza vaccine is not something new. The influenza disease is not something new.
Yeah.
It can keep happening. It will continue to keep happening. It's best if we use all resources that is available to us, right? Have the awareness, educate yourself, speak to your doctors, get the vaccine on an annual basis. I give it to myself. My whole family gets it, including my parents and my young children, because I am exposed to all sorts of viruses, and influenza can be quite nasty. So speak to your doctors about it. Go and check out the campaign. The Flu Prevention is an Act of Love campaign, and learn more and ask your doctors about it.
Yeah. And if your children complain, stab them when they're sleeping.
No, we don't do that.
You don't?
No, we don't. Don't scare them with needles. So then they become adults like you who's afraid of needles.
Oh, yeah. All right. Thank you so much, doctor. And I hope to see you again soon. Not 14
Not
years
14
from
years,
Not 14 years from now. Not sure I'll be around here or not. That's the question. Right. Thank you so much. And we hope to have you again. And thank you for putting the whole influenza prevention thing in such a easy to understand package.
You're most welcome.
Thank you so much. Right, so that was Dr. Rakhee Yadav, consultant pediatrician with KPJ Damansara Specialist Hospital. We spoke about the importance of influenza prevention. Very, very important. And there's a lot of resources out there for you to check on this. So make sure that you go and check it out. But right now, let's get on back with the music. I'll be back in the next hour. Don't go anywhere.